Hello, this is Dr. Medina from Rice and Beans Doctor, explaining medicine as simple as making rice and beans. Measles. There's right now an outbreak in the United States, so this topic is very important for you to know what is measles, how you can get it, how can you protect for it, who's really at risk, and what's the treatment. So stay tuned right now.
Hey everybody, yes, we're going to talk today about the measles virus. But if we want to talk about the measles virus, about the multiple outbreaks that we have seen, like that ship that was quarantined for measles cases, the multiple outbreaks in New York and in other states in the United States as Portland, we definitely have to know what measles is. Measles is an RNA virus from the Paramyxoviridae family. Try saying that 3 times fast. And it evolved from a virus that actually affected cattle in the 11th and 12th century called the rinderpest virus. And every time we have one of these shady interactions between a virus that was starting in an animal and then in a human, we think that there's some sort of involvement. No, there is no vampire cows. There's no cows biting humans or nothing happening like that. Although, I gotta admit, that would be a very scary movie. And just how you get measles? Well, just like many other viruses, it's spread through respiratory particles. So somebody that has measles is sneezing, coughing, putting forth their particles in the wind, and you're just happening to be close by, breathe them in, and you get the virus. How does measles look? What are the signs and symptoms? That's the right question to ask. Well, it's fever, pain in your body, cough, sneezing, sore throat. So it could be anything. It could be influenza. It could be a common cold. It could be dengue fever. It could be chikungunya. It's a fancy name right there. It could be any of those illnesses, but there are specific symptoms that point to measles. Another situation is if you're in an area that's endemic, that's had a recent outbreak, well, your clinician should be on the lookout exactly for measles. But maybe 2 to 3 days after symptoms start, you get some white spots on the inside of your mouth. Let's pull up a couple pictures. They are called cop lick spots. And 3 to 5 days after the symptoms started, and by the symptoms I mean fever, chills, body aches, you'll get a flat maculopapular rash, so a flat red rash all over your body that comes from the immune response to the virus. And let's go back to Dr. Medina right now to get a sense of outbreaks, of recent outbreaks that we have seen and why these outbreaks are happening.
Now, has there been other outbreaks in the United States? Yes, there has been other ones. We have at least seen measles since 2010 or maybe before. There was an outbreak in 2018 in New York, New York City, and the state of New Jersey, mostly coming from Orthodox Jewish. And why? Well, usually they were traveling to Israel. Last year there was an outbreak right there, so people who were not vaccinated came to those states and they infected other people. There was another outbreak in 2014, this one in Ohio, in the Amish population. Also contributed to this outbreak was an outbreak that occurred in the Philippines. Now, right now where we at, 2019, at least there has been 704 cases so far right now till May the 1st, CDC reports.
All right, so what is the treatment for measles? I wish I could tell you something really specific, but just like any other virus, measles is supportive care. So ibuprofen, the all-knowing, all-godly ibuprofen. So non-steroidal anti-inflammatory drugs is the mainstay of treatment for the body aches and the pain. Of course, judicious hydration, keeping oral intake of fluids helps a ton. If there's patients that are compromised, immunocompromised, patients that are pregnant, patients with previous respiratory illness like asthma and COPD, so that includes smokers in there, is going to be an illness that's going to affect them a little bit more deeply, and it may leading them to the hospitalization and IV hydration and close watch by hospitalists inside the ward. The only tool that we have to prevent this is vaccination. And vaccination for measles is included in the measles, mumps, and rubella, the MMR vaccination that you get at 12 to 15 months and then at 4 to 6 years. It provides, one shot provides 93% immunity against measles. The second shot boosts that up to 97% of immunity, so it's completely worth it. For adults that have not had any type of vaccinations for the MMR, you could get 2 MMR shots separated by 28 months, and you would have good immunity around the 93-97% as well. Look, vaccines are in a lot of controversy as of recent, but they have proven to be really effective against viral diseases. Now, I know that if you research vaccines, there's a ton of ingredients in there that are deleterious to health and that might have really bad side effects, but there's no biological free lunch, right? Just as in all medications have their side effects, vaccinations also have their side effects. There's been individuals that have had serious allergic reactions to vaccinations, but that shouldn't hold you back from getting the vaccination, because these diseases, these old diseases, have very intense consequences in the population. Myself, I consider myself a clinician that likes to hear their patients. So if you have any concerns about vaccination, do bring them up with your doctor. If your doctor is not willing to listen to what you have to say, then it's time to go maybe get a second opinion, because at least you have to listen to your patients. Even if you can be outraged because a patient is worried about a treatment that you're going to give them, something that you're going to put inside their body. So you have to listen to it. But in the flip side of the coin, please listen to the doctors. Please listen, because we have the experience of dealing with these diseases and the vaccine. So it has to be a two-way street. I am willing to hear any theory that you guys have. I'm willing to read any paperwork or studies that you guys have against the vaccine, if you do the same with me. So please get vaccinated. Know these signs and symptoms for measles, and it will definitely improve your health and the health of future generations ahead of us. I want to thank you guys for listening to our video. The page has been very lively. The subscriber count and the likes are incredible. So thank you for your support from me and Dr. Medina. Until next time, this is Dr. Yared Vazquez for Rice and Beans Doctors. Measles suck.